Hello friends, we are here to discuss a very important issue. A lot of patients who have undergone a hair transplant surgery, sometimes even they don't know these basic facts. A lot of people think that FUE surgery can be performed twice or thrice from the same donor area. Sometimes they think that the density at the back of head is not affected and you don't get any scarring because of FUE surgery. Now, okay, let me show you some pictures and give some examples so that you understand this concept pretty well. When we take out FUE from a particular donor area, there are some scars left behind, like the wounds, the small wounds as you can see in these pictures. Now when these wounds heal, there is scarring, and most of the times people think that if they have undergone an FUE surgery, they can easily shave off their head and they don't need to worry about that. They can really keep very short hair. Again, this is a myth. Look at these pictures. These patients had undergone FUE surgery and you can see there are a lot of scars which are there on the back of their head, and it is almost impossible to hide these scars. Now, when we take out these grafts, the wounds heal with scarring and the angle of surrounding nearby hair changes. As you can see in this animation, when the wound heals underneath the skin, the angle changes. Now, if this is skin level and this is the position of hair which I'm going to take out in second FUE. This was before first FUE. When we do second FUE from the same donor area, now the angle of exit remains same, but because of scarring, the angle underneath the skin changes like this. So it is very much possible that the exit angle remains same and the angle of hair which is inside the skin, underneath the skin, changes. It may get pulled this way or that way depending upon the amount of traction and direction of traction which the nearby hair are doing. So when the angle changes, now when we try to take out second FUE, these grafts are going to get destroyed because FUE is a blind procedure. So already when we take FUE, even in the first FUE surgery, the donor area density is severely compromised depending upon the number of grafts which you are going to take out. And as you can see in these pictures, this is a comparison video of FUE and FUT. In one patient, 2000 grafts were done by FUE. In the other patient, 3500 grafts were done by FUT. And if you take a look, there is a significant depletion in density on FUE side as compared to FUT side. So when we take out second FUE from the same donor, the donor area gets demolished, it is destroyed, and we really don't get a very significant output. As you can see in this patient's case, he was operated somewhere else and 2 FUE surgeries were performed on his scalp. In the first surgery, he was not happy with the density, so he requested the clinic to do another, and they did second FUE, and still he is not happy with the density, with the hairline. But now the major issue is he has developed a gap behind his transplanted hair, as you can see in this picture, and this is a major problem. And look at his donor. Second FUE actually destroyed his donor. There is hardly anything left, which is a real bad scenario. Because of commercialization of things, you might not get a correct honest opinion from everybody. There are only very few clinics which perform both the types of surgeries, FUE and FUT. I don't advocate FUT or FUE. Everything depends on the individual. I feel that everything should be told to you in a clear way, and the final decision should be yours. In my practice, almost 70% of the cases which I am dealing these days are repair hair transplants. Patients who are really not happy with their density, the shape of hairline, or they have further recession of hairline like after transplant, and they want to fix it up. And when I look at their donor, most of these cases are 2 or 3 times FUE. According to me, second FUE from the same donor area is a crime. It is a crime. And a lot of people, unknowingly get this done. So it's my sincere request that please get your facts correct. Usually in high grades of baldness, we recommend a combination of FUT and FUE because that is the only procedure which is going to give you some density, a good number of hair. And patients who undergo an FUE surgery and then second FUE surgery, this is not going to solve your problem at all. If you like the video, please press the like button. You can also subscribe my channel for more information. You can follow me on Facebook. Thank you. Love yourself. Stay blessed.